everyone. This is Kavita Kukunur, homeopath from USA. Welcome to KHA Homeopathy Study Group Pro Bono webinar. Good morning, good afternoon, and good evening. So nice to see many of you from different countries and different time zones. Before we start our webinar, we always thank Universe for giving us this great opportunity. Dr. Sweta Singh, our KHA Chief Administrator, will start the session.
Hello everyone, myself Dr. Sweta Singh, KHA Chief Administrator. I would like to take the opportunity to introduce KHA Homeopathic Group to all of you. KHA Homeopathy Study Group Pro Bono was organized and founded by homeopath and humanitarian Kavita Kukunur, President and CEO of Kavita Holistic Approach, KHA. This group is intended to be an offering from Kavita to the homeopaths around the globe, sharing goodwill and solid clinical work within the classical model are foundational principles of KHA. KHA mission and vision are very unique to inspire young homeopaths, mentor, provide excellency for educational purposes, using holistic approaches via webinars, which are based on principles of classical homeopathy and provide professional continuing educational homeopathy credits for practitioners. We provide merit certificates for spreading the light of homeopathy around the globe. Dr. Kavita is a member of Kevin Friendly Foundation, a non-profit organization that helps to serve poor people in greater needs in India. She is nationally board certified by Council for Homeopathic Certification, CHC, also the associate editor of the Homeopathic Heritage and a China CPD provider. She is the recipient of Martha Ullman Community Service Award by National Center for Homeopathy and Best Entrepreneur Award from Dr. N. Lingaraju, Principal of JSPS Homeopathic Medical College, Hyderabad, India. TANA, Telugu Association of North America, a prestigious organization, honored and awarded her for selfless homeopathic and humanitarian services at Ladies' Night Out on October 2022, Michigan. Also, Dr. Kavita received the prestigious Legendary Homeopath Award with joint hands of Honorable Health Minister Dr. Dan Singh Rawat, Senior MLA Mr. Harbhajan Singh Cheema, Ex-Director Homeopathy, Government of Uttarakhand and Chairman of HomeoCure and Research Institute during National Homeopathic Seminar, Homeopathy, the Future Medicine at Kashipur on 21st August 2022. Our executives, Dr. Deepak Sharma, Dr. Rajneesh Kumar Sharma, KHA advisor, and myself, KHA team were also recognized and presented with Legendary Homeopath Award at the ceremony. We are extremely happy and proud that we celebrated 11 years of our book, Beyond the Limits, a challenge to prove oneself. And in January 2022, we launched her ebook, A Dose of Spirituality with Kavita, in presence of honorable guest of speakers, American Institute of Homeopathy, AIH President, Dr. Alex Becker, and Council for Homeopathy, CHC President, Dr. Sheetal Tiwari at our KHA webinar. At KHA's second annual celebration, our honorable guest of speaker, Dr. Jawahar Shah, Chairman of Enlightenment Education, launched audiobook and hard copy of her second write-up, A Dose of Spirituality with Kavita. We are delighted that it has been more than 1 year now, and we have donated over $1,400 to 10 to 15 charities. To name a few are Kevin Friendly Foundation, CHC, DHMA, GSPS College, VT Seva, NCH, etc. Interested one can reach us for details at kstudygroup@gmail.com. As of now, we have over 300 plus recordings on professional webinars related to homeopathy, health-related topics, and inspirational talks available on our channel, Kavita Kukunur. This webinar is moderated by Ka family, myself, and Dr. Pooja Naik, Ka volunteer. It is being recorded as we speak, and we will take the question at the end of the webinar. We will post jot form in Zoom webinar chat at the end of the webinar. Please fill the form to receive your certificate. Kindly mute yourself and turn your video off for better connections. Over to you, Dr. Kavita.
Thank you so much, Dr. Sweta. She manages our activities with cute smile. And Dr. Sweta, is Dr. Pooja there?
Yes, ma'am. I would like to request Dr. Pooja to please read Code of Ethics.
Hello everyone, good evening. So today I'm very pleased to inform you everyone for KHA ethics and benefits towards you all. So KHA Homeopathy Study Group is just like a very good platform for everything. So now ethics and benefits. To be a KHA speaker needs at least 1 to 2 months active volunteering. And again is only KHA speakers themes are promoted in newsletters and webinars. KHA providers volunteering for 2 to 12 months respects and inspiring the volunteers to grow. Active volunteers will be promoted through our website, social media, and added to WhatsApp group. Now, our articles of the volunteers will be posted on KHA website and the newsletters and will be set for the publications journals too. Again, the volunteers and the speakers are eligible for the prestigious KHA annual awards. And volunteers are eligible for KHA inspirational talks as well. Volunteers are eligible for the case discussion, and KHA promotes homeopathic organization as well as their mega events. KHA promotes great works of speakers through their books reviews. Honorable guests may propose their futures, courses, or events after the webinars. KHA maintains a healthy and happy environment, so keep only like-minded folks. And KHA requests everyone to maintain the confidential of the groups. So we are highly appreciated that we are volunteering this group, and we are blessed to attach with this group because it's a very good platform for everyone. Thank you, Kavit.
Thank you so much, Dr. Pooja. She's our enthusiastic volunteer. And I thank Ka Homeopathy Study Group entire team for the continuous selfless support with which we are able to make our pro bono activities and webinars so beautiful. These webinars are for educational purposes only and should not misuse any of the course content without speaker's permission. Always seek an expert homeopath for treatment. Happy Women's Day month to all of you. And quick announcement. The Joint American Homeopathic Conference, JHC, is on March 24th to 26th this year. JHC is a wonderful platform for connecting, learning, and growing with the world-renowned homeopaths who share their knowledge and wisdom. I was so fortunate to get opportunity as a speaker along with our today's speaker, Dr. Laurie Grassman, who speaks about pregnancy and childbirth. And as I'm one among the honorable speakers doing on-demand presentation on topic homeopathic healing with Realm of Impondables. JHC 2023 conference registration is available as virtual and also in person. Do not miss this great opportunity. See you there. And for more info, visit jhc.info. And we have a special coupon for car participants. The code is NCH75797. This is worth $20 of a 3-day in-person or 3-day virtual registration. And let us welcome our second speaker, Dr. Katta Renuka from Telangana, India. We both are from same medical college. She is my immediate senior. We are from JSPS Government Homeopathic Medical College. She did her MD from KHA Medical College, Beed, Maharashtra. She started her practice since 1995. It has been almost 27 years of classical homeopathic practice dealing with all types of diseases mentioned in the medical book, including the rare diseases, and she has seen great success. Precisely treats anything from cold to cancer, also trains fresh graduates in her clinic so that they can gain practical experience in the field of homeopathy. And she's serving homeopathic community at large. She's one among those practitioners who have a continuous successful roaring practice. She's passionate and dedicated homeopath. She has presented many papers in several seminars. Presented in International Homeopathic Conference, Bangalore, 2017 received many felicitations, and also in different occasions she presented the conferences. She received Lady Regent Award in medical field in 2018. Received Pride Homeopathy in 2023 from Kiran Seva Santan, India. She is life member of Indian Institute of Homeopathic Physicians, Homeopathic Association of Telangana, and also life member of HAMI, National Journal of Homeopathy. And there is so much to say about her. And for more information, visit her website www.Renuka Katta, her first name and last name.org. And let us welcome Dr. Renuka to our webinar.
Thank you, Dr. Kavita, first of all, for your introduction. It's very generous. And here I want to first thing appreciate and I stand the work you are doing for the propaganda of homeopathy. Most of the times I've seen people, especially who go to US, they will be not like India. You have to literally start from scratch to establish a proper homeopathy and also rules, license and everything. Besides that, you are more interested to do the things for publicizing and enhancing our homeopathy system globally. I really appreciate for that. And thank you for inviting me for this webinar in your this program. I'm very happy for that. Thank you. Here, good morning, good evening, good afternoon to all the people. Here I want to mention, it's as she in the introduction she mentioned also. First thing is, it's being a women's month, and all the speakers are women and the host is a woman. So let us appreciate for that first point. Okay. Thank you once again for all to give me this opportunity. So first of all, I've seen like last practicing 27 years and I was training in my clinic, and also whenever I go to seminars and some medical camps and everything, I've seen many fresh graduates will be scared to what to prescribe. And also new practitioners will have doubts about the prescription, whether it is correct or not, or will it be cure the patient or not. And adding to that, what they have heard around them is make them more confused, low confidence, leads to the extent of doubting the homeopathy system and its principles. In that confusion, they try to do all the so-called methods, forgetting what they learned, and so fail in execution of the same. So this is the most important, my main idea of addressing this topic is to make all homeopathics keep going in right way, that is homeopathic way, exactly Hahnemann way, which nowadays we are calling classical way. Unfortunately, even the graduates, they think that it's a 250 years old system, we need to change. We don't know what's we taught, and the practice practicality is something different. But one thing I want to say, the anatomy physiology is almost the basics are the same. So when basics are the same, there is no point of doubting the principles of homeopathy. So this is the reason why I picked the homeopathy prescription topic, which may be helping for the most of the people. And I have been attended so many methods of prescription base, which either confuse the fresh graduates who are well trained for 5.5 years, and also makes them to lose the confidence of what they learned, or they have contradictory to each other systems. So so that the fresh graduate thinks that whatever they have studied phase and they have to start a new course. And in that also there's a cross section which they have to join which course and everything. And we have seen so many training courses, methods and gurus, etc. But with due respect to all the training session people and everything, I want to clarify and clearly mention that after the graduation, any training or course should be very short term, and also it should help and boost their confidence. What they learned in the basics of the graduation are basics from the organ. And also these courses or this training session should help them in handling the so-called tough cases and everything. So I want to give a clear vision for all the fresh homeopathic graduates and of course new practitioners or who thinks that there is a problem with the homeopathic prescription. So first of all, for any homeopathic prescription, the soul is the proper case taking. Unfortunately, even case taking, people think because they are not know what to be do or not, so they'll be asking a question which are not relevant or anything. The case taking is to know what's the sort of a patient who has a disease. We are not looking for a disease. We are looking for a patient who is suffering with the disease. In fact, that's why there's a saying came, saying that medicines treat the disease and the doctors treat the patient who has a disease. So make sure that the case taking is the first part of the homeopathic prescription. And also I want to mention, especially for the fresh graduates, though the aim of case taking is to find the remedy, but while taking the case, only concentrate on the case taking rather than going to choose a remedy in a hurry. First of all, understand the patient. It should be like a conversation. Never look the remedy immediately. One symptom came, you look for a remedy, and the second symptom comes, you look for some other remedy. Then it makes you confused, saying that again you end up not choosing a right prescription, or you don't know what to prescribe. So first, to leave the remedy aside, listen to the patient, understand the patient, and take the whole case in a complete way. Then we can come to the last stage of the remedy. There is no hurry to go for it. And also do not try to interpret the conversation during the case taking with our medical way or in a homeopathic way. First, let the patient complete. If you listen to the patient, he is telling you the diagnosis and then the remedy directly. So never be in a hurry to choose a remedy in the first part of the case taking itself. And also sometimes patient will be deviating from the topic and this thing, but still keep the your patients so that it will definitely look into and drive into the correct remedy. And also one more thing I want to mention, when you don't have a time, especially in chronic cases, never take a case. Don't think you can do the case like just a 1 or 2 cases. Probably once you are experienced, then you know even your experience is to how to cut the unnecessary talking of the patient or to drag him to the right track. But whether you are a first year or you are a 27 years practitioner, the case taking is the same. Only thing is how to handle the patient, not to deviate from the track. That only your experience makes. So make sure the case taking should be important. And also I say, when you're training our house agency or when you're going for this training courses or when you're joining some doctors for a short term and thing also, make sure to take most of the case takings either in a OP or an IP, because it helps you how to take a case taking in a short way and what is a good way of taking a case. In fact, I even myself and also advise everybody, house agency is the best period to do that, because that time, first of all, we don't have exam pressure or anything, and also you don't have any responsibility of curing a patient. So you can do it much better way rather than after passing in graduation, then you will have a tension that it is your case and your name and all those things. So use your periods of training sessions or anything to take a proper case takings in elaborate way, in a shorter way, and use the experience of that doctor with whom you are undergoing. That's where we say well taken case is half cured. So the case taking is the most important thing. And once you have taken the case taking, write down the symptoms, the prescribable symptoms in a homeopathic way. Because as everybody knows, I'm not going into the detail of common, uncommon symptoms. The common disease symptoms, we are not prescribable symptoms. So we need a patient reaction to the disease. So in a way, PQRS, everybody knows. I put it as soil. Say S stands for subjective, O stands for objective, I stands for interrogative, which also includes your modalities, because sometimes patient simply says, I have a back pain. And then he will not elaborate it. So we have to interrogate those things, what makes him much better or worse and everything. So, and the last but not the least is the lab investigator. So to make it remember, I say soil. If you have the soil symptoms, then you can definitely ready for the prescription. So once, if you have a PQRS symptom, of course, no need of saying, even I think a first year student also can prescribe. And mostly these things happen in an acute case. So it's very easy to prescribe any remedy. But the problem comes, and mostly in the chronic cases, where you will not find a PQRS symptom. And before I go into the chronic case, I also want to mention, even though there is a PQRS in any cases, and single remedies, sometimes you are not sure about the prescription. That's where I say you look for a causation, probably, or some other symptom, which will support that prescribable symptom of either PQRS or characteristic symptom, which I call it as a cross-check symptom. So it boosts your confidence of the drug, and also you are sure about what your prescription is going to do, which you can share with the patient. So the patient indirectly gets a confidence in the doctor. So this is how you always, after that, cross-check symptom should be more important, which will boost the prescription action, which you will be sharing with the patient, so that even patient, tomorrow when he calls, he knows for sure what you said, what the prescription is doing it. And then now we're talking about the chronic cases. In the chronic cases, we don't see these kind of symptoms, mostly because of the patient previous treatment, where he's already on some medications, are too complicated diseases and symptoms. Our patient is not in a position to describe, or sometimes non-cooperative patient. So what to do? In fact, this is a $1 million question for many of the people. And that's where these confusion in the homeopathic prescription started. And that's where people going for too many other problems, too many other methods, which they don't have a confidence, and they're losing under the so-called leaving the single remedies, multi-drugs, and those things. I say it is very simple, though it is a $1 million question. The simple is classify the disease under Hahnemann classification of the diseases. Once you have taken the case, first classify the presentation of how the case is presented. The presentation comes under each class of Hahnemann classification of diseases. Once you will be able to classify the disease, then definitely it is so easy that the guidelines are given under each heading. So what to do, what is the remedy to choose, and everything is given. So simple ways, follow first to do the classification, and the guidelines is given. So it's very easy of your homeopathic prescription. No confusion, nothing. And also by doing that, even physician himself knows whether the case is incurable or curable, or if it is all curable, to what extent also. So even on the first visit, if you tell the patient these are the things, the patient will be also knowing what's happening to him and what is going to do the help by the physician, so that he will be coming with an open mind for that kind of prescriptions. And also it boosts the doctor's confidence, and in turn our homeopathy system elevates. Always share the truth and honest with the patient, so that it will not impact you, as well as our moral responsibility that it should not impact the homeopathy system. Unfortunately, I've seen with many of patients, they go to some allopathy doctor where they couldn't get a cure. They are ready to go to another 10 allopathy doctors. But unfortunately, when they go to one homeopathy doctor where they don't get a cure, they immediately say the homeopathy system doesn't act. How can, they are human beings, so even one person can fail, but the system is not. So this is where I'm mentioning, let us educate the patient about the homeopathy also, because now, as everybody knows, homeopathy is the upcoming and the only way of future upcoming diseases curability also. Only it's homeopathy, as we have seen the recent corona also. Though allopathy helped to palliate, homeopathy is the only way of curing. So make sure that you be honest with your patient, always what you are going to do, tell them in clear way. If you are not able to, take your own time and then go through the case and then inform them. So this is the basic important thing. Never misguide the patient. And the one more important point what nowadays I have seen is, most of the times they are not doing a examination of the patient. Of course, last 2 years because of the corona, and also even then also I say, when you are doing an online consultation or a video calling consultation also, still you can do a medical examination. If not directly with your steth or anything, with the torch, you can ask the patient to open his throat and show the tongue and show your ear to the camera with putting the lights in, because that's how. And this medical examination is the most important thing in many cases, which will directly guide to the remedy. Here I want to share one of my experience during my internship. When I'm doing an internship in my this thing, one of my colleague came with a fever, where she shared that she had a like night out because of the puja. As all are decided, yes, it's going to be, yes, anybody, cocculus, yes, lack of sleep. So it's almost decided and ready to prescribe. Then our professor said, open your mouth. The moment we saw, we are all shifted from cocculus to the Rustox. Yes, as you know, red triangle tip. As I earlier mentioned, the cross-check symptom, even Rustox has a strenuous exertion and everything. See how important the physical examination. If we don't know the physical examination, we decided to give the cocculus, and we only say homeopathic medicine didn't act, the homeopathic medicine is not acting, homeopathic principles are wrong. So the fault of a doctor should not affect the system. In fact, that's why I'm clearly saying, when you are taking a case taking, write down your steps. And it should be like a conversation, not like a what it's mentioned in the Hutchinson. When a patient comes, even recently I happened to attend a medical camp in Madhya Pradesh, where I was sitting with a almost like a, sorry to say, but postgraduate with 5 years experience. The moment she started a case taking, the patient said, what are like symptoms? He said back pain. Then she says, okay, do you have any gastric problem? Do you have this? I said, what is the relevance of this thing? Let the patient speak. And then immediately say, okay, when is the back pain more? He literally opened in his own language, Rasta. Then she said, oh, it is so easy. So this is where I'm saying it. The like you can't ask like what is your name and age. Even the OP, they come with the OP sheet or anything, you can see, and then you can talk with them with their name and everything, so that they'll be little bit friendly and comfortable when they're talking with you. So make sure once everything is over, physical examination is also very, very important. So to identify the simillimum, it also helps, and sometimes it gives a direct symptom. And also here I want to mention another case during my practice. In my practice, a boy came around 8 years age with a sudden ear pain. There is no fever, there is no cold, there is no injury, nothing, no history of anything. I tried ask anything, nothing was there. So I said, okay, let me do the physical examination. When I was doing the physical examination, throat is clear, no congestion, ear is fine, no congestion, no, nothing. And the next thing is I saw the nose, and there I could see something is obstructed. Then immediately I make them to go to the X-ray. In the X-ray, they're showing some foreign body. So obviously I sent to the ENT doctor. And that's a peanut which was in the nose. Because of the peanut, which is giving a ear pain. And the moment ENT has removed the peanut, the ear pain is gone. So in these cases also, if I wouldn't have examined and I couldn't understand the foreign bodies in the nose, and I would have ended up giving some prescription, my prescription would have failed, and we say that homeopathy is not working. So make sure even physical examination for homeopathy is very, very important. Even I come across some patients, they say that homeopathy doesn't need investigations. Homeopaths doesn't even know how to examine. Do they need the examination? This is what is there in the patient, because so many homeopaths are not doing examinations. Let me say, whatever the science we have seen in our Materia Medica, all comes only when you do the physical examination. Let it be clinical, physical examination, even also lab investigations. Because lab investigations also gives a lot of info about the remedy. Of course, the second part of the prescription about the potency and the doses, third part of it. So that will come later. So make sure the case taking is an important phenomenon. If your case taking is successful, you are dot on the prescription. So now I want to mention the types of the prescription. I'm not talking about the methods of and the pathways. I'm talking about the types of prescription. Yes. Grossly, I put it, the first one is acute. This can be again subclassified as a proper acute case, like a general fever or diarrhea or anything. And the second acute is acute exacerbation in a chronic case, like in asthma or epilepsies, we'll tend to see the fits attack of that particular chronic this thing. Or in rheumatoid arthritis, also you see immediate attack of that this thing. And the third acute one is also during the chronic case only, there is a different acute problem. It is not the exaggeration of the chronic problem. Like say you are treating an osteoarthritic case and suddenly he has a fever, suddenly this thing. So all this can be like a headache on the acute case. So even why it is important is, if you are aware of it's a direct acute case or it is a acute exaggeration of the chronic case or a different problem, say this, according to that, you can choose the medicine, and sometimes whether you need to give a medicine or not also it makes a call. So make sure that what is the type of prescription you are giving also one should know. And the second is the chronic prescription, which one can also call as miasmatic prescription. These in this case especially, the first prescription can also lead to the cure, can also spoil the whole case. So make sure, unless you are not sure about the remedy, never be in a hurry to prescribe a case. If you have a time, it is not that emergency, put them on a placebo, make your homework properly, take the case again and again. Unless you are sure about the remedy, never do the remedy prescription. And even sometimes I've seen you are in a hurry, and best to give the sake of even nowadays the no source came, like when osteoarthritis came, osteoarthritis is given, and what the people think is, now let me give this so that patient will have some relief. Tomorrow when I have term or he comes back my second visit, I will give it. By the term, this prescription will spoil the whole case. So make sure never repeat this kind of things. And of course, the third thing is the intercurrent remedy. It is very important when to give the intercurrent remedy, and it has to prescribe when the problem is not in an acute phase. And especially we have seen this intercurrent remedy in intermittent fevers, where the fever is at a low phase, not at the higher end. And even this intercurrent remedy can sometimes, in very chronic cases, we need to be given on the basis of family history, which we say miasmatic. Which will help, especially we have seen some chronic cases like asthma cases or anything, you give the remedy of any remedy which will give them cure for a certain period. Again, there will be relapse. So those are the cases where you need to give the intercurrent remedy. The last type of prescription, what I say, is the preventive prescription. Yes, what we call is genus epidemics. Yes, to be frank, genus epidemics cannot be universal, because as homeopathy, we know the basic principle is it varies individually. So though genus epidemics, it varies from place to place because of the habits and because of the weather conditions and so on. So if one wants to make a universal genus, like last time for COVID it happened, so we cannot give the on a regular basis of genotypes, pick the miasmatic condition of the disease, at what level the disease is presented. On that basis, you can pick a genus epidemics on a universal basis, and most of the times it will be end up a no-so. Like last COVID is more of a, as everybody knows, it's a sorosyphilitic. Though complication sometimes it can be psychotic, the disease presentation is more of a sorosyphilitic. So the best no-so for this is, as anybody can take it, tuberculosis. So make sure genus epidemicus, if you are giving, give it in a local areas, local, whatever the cases you have seen frequently on that basis, or if you want to universal, you have to be a more of a mathematic presentation of the disease. In fact, if we don't do that, the other people are a layman, they don't know why different homeopaths are giving different genus epidemicus. So that's where they end up saying that homeopathy is not curable. And of course, the people who are waiting to degrade the system and everything, we will be giving a chance for them. So whenever we are declaring one genus epidemicus, then declare according to the area also. This is my one more suggestion about the preventer. So always whenever you are seeing the case, in your memory, you also rewind, say what is the type of prescription that case is required. And there is a no universal rule to prescribe. There's only one way of thumb rule is that the way case is presented, on that basis only one has to give the prescription. And when you are giving a prescription, we can choose many ways. Like say to reach USA, either we can go via Dubai, or we can go via German, or we can go by London. So which is the better way, which is the cheapest way, which is the fastest way? That is how we generally look for it, right? In the similar way, whenever the cases come, first let us see the way how the case is presented. We have to choose a method the way case is presented. For example, as it happens in a very acute case, we almost get a direct in the first two conversation, first two, I can say lines, so sentences only, we find the remedy, because it's so acute if we can know the remedy. So the first thing is presentation. It very the acute remedy, which anybody can give it as acute remedy, and which will be helping immediately, where you can also confident saying that this will be helpful. Then second thing is, when we don't get this kind of symptoms, then what to do? You know the symptoms are there, but it's not leading to the any specific remedy. Or it is not giving her straight away one remedy. There are 2-3 remedies which are indicating. Those kind of cases, look for a causation. The causation can be a direct causation, like a fall or an injury or anything. So as I said, that also helps as a cross-check symptom. You can take it and you can prescribe that remedy. Or sometimes, since then I'm not well. In fact, nowadays, most of even all the homeopaths are also getting this post-COVID syndrome. Since that COVID attack, I'm not well. So these kind of since that disease will help us in many ways to get the remedy. Though there's a presentation is not very clear, this causation will help. And during this time only, look for the physical examination. These signs will help you to get into the prescription. And the other method is on the past history. So one thing, as I said, the past history since then also could be. And the other way, what I say is like how we do the doctrine of signature. I say it is a doctrine of signature through the past history with the disease. For example, I've seen many cases, rather anybody sees, and especially when a fresh graduates or a newly, even after 10 years, the patient comes, especially teenagers, they come with pimples on their face. Whatever you ask, everything is fine. No relation with anything. They say only pimples. What to prescribe? How to do it? In fact, dermatologist says you put that, and they also say no oils the moment oil it, but there is no other symptom to prescribe. In those cases, you simply see the pimples. It happened in one of my case. I saw the pimples. They are from almost blisters to the pustules level. The moment I see the pimples, it looked like the concept of the chicken pox. In the chicken pox also, we see all the types of blister to the pustules at one go. And when I inquired about history, there is a history of chickenpox. So simply you give a variolinum with a high potency, it will clear the pimples, or at least it will guide the case to the proper symptoms. So this is what I call about doctrine of signature through the disease, which will lead to the remedy. Similar way, when a patient comes with a like say aspermatoria or there's an infection of the testis, you make sure to inquire about the mumps, because mumps is another chronic effect of the mumps is the arthritis. So there you can think about the nose or parotidium. It will definitely help you. Also in the cases of pneumonia, where right now they will be suffering with the lung infection. So this is how the past history of the diseases will also help for the prescription, because I've seen what to do if the patient is suffering with the chickenpox or mumps or measles. This is the importance. Also, we also have to mention about when you are taking it, the chronological order of the diseases also, because the first disease and the second disease, which is a more impact, which has the relevance to the present condition, that is makes to prescribe our this thing. If say a patient, as I said right now only, the pimples case, she also had a measles or had a fall and everything and chickenpox. So what is the relevance you have to check? It's not simply anybody suffered with chickenpox, but there is no chickenpox. Even like say in a chickenpox, you have a chronic effects of chickenpox is conjunctivitis, like eye problems. So this is the relevance you have to look for. It's not simply whoever comes with a past history of chickenpox, you just end up wearing them and say homeopathy fails. It is you failed. You couldn't understand, you couldn't draw the connect the dots. So make sure the importance of past history, how to look this. So this is how I say the past history to be look in two ways. One is the regular way, the second is this doctrine of signature. So most of the times I've seen it is directly curing the case, not even leading it. So in these cases, we can even minimize the duration, where most of the people say homeopathy takes a long time and everything. We can surely we can say homeopathy also takes short time and gives a complete cure, which boosts up our system itself, elevates, so that we can be more popularized compared to other systems, so that we can help the patients who are needy, and we can improve our, we can make a healthy nation. So make sure these points whenever you are prescribing on the basis of the past history. And the other thing is on the basis of family history, which also helps. In fact, the family history mostly helps for the miasmatic basis of prescription. Again, here also I'm mentioning, it is not a mandatory rule that whatever the miasmatic condition which was seen in the family history is presented in the present condition. You have to see the evolution. Say there may be sometimes even a syphilitic condition in the family history, but the patient is in a psoriatic level. In fact, one very good statement which I want to share here with people, which everybody would have read. When I read, I was stunned and I said, it is, sorry to say, it is stupidity. In a Kent homeopathic philosophy, he clearly mentioned, when you are going through all the cases and everything, you can also predict the patient's, the symptom, the diseases which he is going to suffer in future. I think second-year student, when I read it, this is what I thought, it is stupidity, is it astrology or it is a medicine? It should be. Once I completed my whole course and I could understand what is Arnan is saying, then I understand how we can predict this on the basis of the family history. Even whenever a patient comes with some presentation symptoms, I ask directly saying that in your family who is suffering with so-and-so disease, they'll be so stunned to know, how do you know, doctor? Even these small things will give a lot of confidence to the patient about us, and they will be stick on to you, and you in the sense homeopathy, I'm saying it, so that they will understand how homeopathy can cure. So make sure the miasmatic basis of a family history and the connection to the presentation is more important. And also this will help you in giving a prescription basing on the evolution. Is it from psoriatic to the psychotic or to the syphilitic, or the background is syphilitic? Because of the patient mentality is still in a psoriatic stage. So this is most important about the family history. And then, of course, last but not least, in fact, these kind of cases, what we found nowadays more importantly is just basing on the previous treatment. Most of the patients nowadays, no one will come. Of course, the acute cases may come, or Because if you are established, then you will become a family physician for many families. But in a initial days, or even when your popularity is so much, people will come on the first visit itself. They expect, in their view, miracles. We say homeopathic magic. I think people know the difference between miracle and magic. Magic is what we do with confidence. Miracle is what ignorance. People think it is, like they think magic as a miracle because of the lack of knowledge. So make sure one should be knowing the previous statement when these kind of, where all the symptoms will be normal, like everything will be common, no, and there will be so many symptoms, but nothing will be indicated to one single name. So you can then you can ask what is his previous treatment or on what medication he is and everything. As everybody knows, if he is on Ayurvedic, you can go with Naxwamika. If he is on allopathy, you can go for arsenicol. Or if you are on homeopathy treatment only, where people will be coming with so many multi homeopathy medicines are nowadays even self-medication because of by reading books on this internet and everything. So you can start the case with the TMB. So this is how you need to take the history, and the presentation of the case will lead to what method you have to prescribe. And this is where I'm saying it. If you can go through that, if you can classify a disease, whatever the case is presented, simply have in your mind the Hanuman classification. Immediately put that case which under one heading. Everything is so crystal clear. There is no confusion. It is so simple. Here I want to mention about one of the case which I have seen in my practice. A young lady who came around 30 years. She had one child and one abortion, and she came along with mother-in-law. And she was telling about her symptoms. She says she has a weakness, and the weakness is also aggravated when she takes a rest. She has a breathing problem, difficulty in breathing. It is better when she is on rest, and she has all the body pains. She is hepatitis good. Everything is so vague symptoms, and the modalities are literally not matching to one another. Once the moment she says better by rest, we think brain. The moment she says better by walking, we worse rest, we may think rest. So many symptoms, nothing to prescribe. And probably we also go into that because of that mother-in-law, daughter-in-law kind of. We also try to see that attention part and the psychological angle. Nothing is leading to any drug. Then I asked her about her reports because she said about physical examination. So she said she had a difficulty in breathing. When I asked her her lungs, there is nothing. All the respiratory sounds are very clear, clean, no problem at all. And her heart sounds are very clean and clear. And I've gone through her lab investigation, everything is clear. This is how the chronic cases come, where most of the people think what to do and how to start a case. Here, whatever we have studied or anatomy, physiology, medicine, what is the relevance for the homeopathy to read all those things? If it's only a symptom matching, why one has to read that 4.5 years of anatomy, physiology, pathology, and all other than homeopathy course? So when you analyze this case, she has mentioning about all the pains and everything in her muscles and the ligaments. When you have seen like the lungs, major organs, all are clear and the reports are clear. And in the history, when you look for it, abortion. Since abortion, she has the tissue. That abortion is, of course, is it forcible or they don't want, that's a different story. So when you look for it, all exhaustive small muscles and the ligaments since abortion. It's a one and only remedy in the synthetic repertory. If you are not aware of this analysis and your medical analysis and everything, we end up giving some other medicine. Yes, sometimes basing on all the medicines, you can you can say first whatever the presented group, you give one medicine. Again, she will come with another group of symptoms. You have to again match and medicine. It is like a peeling of onion, which may take a long period. Sometimes patient may not hold with you, like will be held with you for so many weeks and everything. You will be losing a case where you will also losing your confidence, forget about the patient. So the moment you analyze this and you give a Renuka, the second visit itself, she is almost cured. She was so happy that how can I be so well within such a short period? So make sure this is how the homeopathy prescription is. It is like you say in many sports, every coach will say, no, even in a generally in cricket, last ball 6 runs. Stick on to your basics. Same way for homeopathy prescription. It's very easy, simple. If one will follow the principles as it is mentioned in the Argnan. Argnan is like for us it's a like a guiding rule. It is a navigator for us. Even I have read Argnan. Even today I read Argnan. Whenever I have a tough case, whenever I was thinking about a case and I open Argnan, you will find a solution for that case there, which we read yesterday, we couldn't find, today we can find. I one way I say it is like a Bhagavad Gita, Bible, Quran for the religions. It is for homeopaths, Argnan is saying. You keep on reading, you will read again and again, will understand much and much more. So make sure that the prescription is very simple. First, don't get confused. And also, I've seen many people getting confused what to do, what not to do. So either to make you simple, one method what I say is follow the Hahnemann classification of the diseases. It's simple. You take a case, again write all your symptoms, see which under which heading this case presents. Once you have highlighted, the guidelines are given. If not, basing on the presentation, which method of prescription is useful for that particular case. Is it not very simple? Why we have to make it complicated? So now I think if you can follow these guidelines, I think homeopathic prescription is very easy. In fact, I say it is like solving a puzzle. When you are solving a puzzle, you will get some kind of a satisfaction. It is challenging, and at the end, when you do it, the ultimate satisfaction, what you get, you cannot buy with anything. So homeopathic prescription always for me it is like a solving a puzzle. I thoroughly enjoy. Only thing is focus when you are taking a case taking. No other aggravation or hurry, anything. If you don't have time, take one case in a day. But do it perfectly. Once you do it, all the people will be waiting for you for many hours rather than you wait for a patient's doing a spoiled prescription. Okay, so I think the first part of the prescription is very sure. But here also I want to mention one more thing is the single remedy. What is our Metromedica is given? Metromedica is a provings of a unhealthy human beings. What is proved? It is proved a single remedy is proved with a single dose. Okay, in a different way, and our medicine is in potential form. So why one has to literally give a multi-drugs? On what basis you are giving a multi-drugs? Is our Metromedica is anywhere given that multi-drugs provings? The symptoms what we have learned for 4.5 years is on the Metromedica, which was a single drug was proven. So how can one can give a prescription and a multi-drugs? So make sure what you read you can deliver. Where is the confusion? Where the experience? Basic books you say whatever you have a 2 into 2 is always 4. Even if I am being a 27 years experience, I say 2 into 2 is 6. Can it be fine? So make sure it should be single remedy. Always single remedy. And also now coming to the dose part also. Where is the multi-drugs? When we are prescribing, we are like in a Metromedica also, it's a single dose out of which we have given. So how can one can be giving you multiple doses of your fancies? Even I've seen certain cases where you will be giving 3 doses at a time or 1 dose every day for 3 days. Where it is written in any Argnan or anything. It is simply whatever the dose is required according to the case and as per the rules and regulations. It is not our whims and fancies. First, you give the single dose, and then if it's not working, and what is the basis for to repeat? As in the Kent observations is mentioned, you can go for it. Accordingly, you can repeat the case, or it's a structural cases, or it is a chronic one-sided disease where you have to repeat the dose. So first, give it. look for a patient's improvement or what, accordingly you can repeat it, but not on the first day with your prescription without knowing anything. There is no point of going for a multiple doses. And also I came across a few prescriptions with my patients for other homeopaths, especially in acute cases. They say for a fever case, if it's more than 100, it's a high fever, you need to repeat the dose every often. What is, I couldn't understand what is a high fever, what is a low fever? Is it 101 is high where it is mentioned? I never heard in Davidson. Even I have seen patients with 104 temperature. He comes and sits for 2 hours waiting for me, and I have seen him with a 99 temperature. Patient is making a hangama. So it's always again a reaction to the disease, reaction to the patient. It is not the is it 101, 104, what else? Again, like a layman or like a patient, we are also going like a pediatric doctors mentioned or a physician mentioned above 104, patient is ending up with fits or anything. Then how we are medically qualified? And here I've also mentioned to boost your confidence or whatever it is, and it is logical, it is proven as a, we homeopaths are super specialty people. If you talk in a academic way, we are not, even a person who has qualified BHMS, a person who is a MD, I say if you want to compare with the allopathy degrees, we are into the super specialty degrees. Why? The founder of the homeopathic is already completed MD. After that, he found a homeopathic system. So whenever you feel, like, in fact, I tell every homeopath, you believe yourself that you are a super specialty person, academic presented. So the moment you have this confidence, that confidence itself makes you to look into the case, and so that your prescription will be much, much better. Make sure you are thorough about your subject, nothing can go wrong. And this I'm saying, even my first day of practice, even out of, you can think that after 27 years I'm speaking this way and everything. If anybody interested, I can see my first case sheet, even today I'm holding it. Even what I have received day before yesterday. Also, there is no mistake in the prescription. Experience makes, as I said, maybe case taking easy, and we can even command the patients. We can also control the patients of their deviations and everything. But the prescription is the same, because your knowledge is very good, the prescription will be the same. Now coming to the second part of the prescription, which is a potency. Here also we have seen high potency, low potency, or you have to start with 30, you have to start with 200. Again, no, there is a basic principles in Arnan which was written as per the presentation of the case, with which potency you have to start. 30 is not a low potency, 1M is not a high potency. It is a suitable to that patient presented case. That is where we decide. So always make sure the potency should be decided by the presentation of the case, and also on the which method of prescription you are giving it. If again I say in a prescription method, like you are choosing on a mathematic basis, or you are choosing on a no-sod, like as I said in past history or on a family history basis, mostly you have to start with 1M, because it has to act in a deep acting, because it is genetic acting where we are taking the method of prescription. Or if you are doing in a Hahnemann classification way, if it comes under chronic disease or as a one-sided diseases, again you have to start with the 1Ms. So it again, there are guidelines on which potency you have to start. And also there are guidelines where you have to like accelerate the potency, or where you have to decrease the potency. So simply follow the guidelines. It is so simple. It's like when you're going with a Google map navigation, it will give a directions and you will reach your destination. Homeopathy Arnar is giving us, it's a much more navigator for the prescription, for the potency, and also dosage. So only one has to have that navigation app properly in their mind. That when can happen when we can read properly and we can understand. So make sure that one has to simply follow the guidelines, and it gives immense pleasure when you are doing these kind of prescriptions. And the third and last, not the last part of the thing is dose. Again, how many doses? As I mentioned, 3 doses, 1 dose, single dose, everything. As mentioned, it is again the rules are given when to repeat, when not to repeat. It purely again depends on the type of the disease. Here also I'm mentioning type of the disease, not only the type of the presentation of the case. Because in structural changes, again the guidelines is given in the organ, where there are a lot of structural changes, you cannot repeat the dose, because once our medicines are deep acting remedies. The moment you are repeating it, it will hurt much more the tissues, which will damage the patient. So be cautious whenever you're repeating in structural changes. That is how, this is the reason why we also need the lab investigations to understand the depth of the damage of that particular disease. So make sure that everybody should be following the basic guidelines of the OPNAL in all the 3 levels. One is the prescription remedy, second is the potency level, third is the repetition part. So make sure that homeopathy prescription is not as people are guiding you, it's difficult or it's 250 years old, nothing, and your 4.5 years well trained is more than enough to go through a direct clinical practice, provided you are sure about your organ. In fact, I tell most of the people, yes, Metromedica has to be by hearted, because you should remember that it's a memory. Organ is a simple way of to understand the thing. It is like a guidance. You know, once you know the guidelines, any kind of case, that's where I say a homeopathy can treat from cold to cancer, irrespective of the name of the disease, because you have a guidelines, the way the case is presented. So now after, because as I'm taking more time, I think people will be more clear about the homeopathic prescription. I'm not going with the second prescription, which deals with the chemical observations. Maybe next time, anytime, lack of time. And even there, I mentioned you just go through that chemical observation, which will give a clear indication for the second prescription. So now I want to conclude, and I think and I wish that now for everybody, homeopathic prescription seems so simple and so easy. It is not as confusing as many people. So thank you once again for everybody. And if you have any doubts, any queries, can please.
Thank you so much, Dr. Renuka. And Dr. Sweta, would you like to take any questions, please?
Sure, ma'am. We have only one question from Dr. Poonam Chablani. Ma'am, even first prescription will vary from doctor to doctor for same patient. Then how to make it?
I don't think so. It should not vary, basically. Why it varies is because they are not taking a proper case study. If everybody is taking acute case, simply I'll say, if there is a red triangle tip, how it varies from doctor to doctor, right? So it is a failure of a case taking of that particular doctor who could prescribe a proper medicine. That is where I will stress more on the case taking. So make sure, give all your time for the case taking without, that's where we are unprejudiced. But what happens, we are in a so hurry, the first moment patient say back pain, okay, we'll go through all the remedies. Never do that. Wait till the patient completes all the modalities and everything, then look for the remedy. I don't think, okay, it is a saying no to women, opinions will be the same, no to doctor's prescription is the same. Women part, I don't know, but homeopath should be the same if it's the same case. So I hope, again, here I want to mention the doctor, the case change is not, if not proper, then ends up the different prescription. Or in a chronic case, as I mentioned, and which method the doctor is choosing a prescription. As I said, if a person is taking on a presentation, and the presentation of the symptoms is picking a remedy, then the other second prescription will give add up and you have to go. If you are hitting on the base, like as I said in the past history, on the family history, if you are taking it, the prescription varies, the remedy varies. So you also have to mind on which type of case takings the two doctors' prescriptions are varying, because here method of prescription is varying. As I said, simply to reach US, somebody is going through London or somebody is going through Dubai. Finally, you have to reach the US.
Thank you so much, ma'am. Yes, ma'am. Thank you. Any more questions? Can we have some more questions from the audience?
We will take one last question, please.
Yeah.
This is where until we hear from the participants, it's very unique, Dr. Renuka. Today's session, it is very refreshing. And like with the case examples you have shared, the new tips and several different ways to come up to the right prescription with confidence. That is really great. And it could be either acute remedy, chronic remedy, and intercurrent, and also the based upon the doctrine of signatures. So we will bring you back again with the second prescription and 12 observations and more. Okay.
Thank you.
Yes. So,
And
Dr. Yes, since we just had 2 hours, so we were just in any case, if anyone has any questions, please let us know. And Dr. Sweta, would you like to say anything more, please?
Yes, ma'am. It was very enlightening and informative session, and thank you for this great learning. Thank you so much, ma'am.
And
Dr.
also, if
Sweta?
anybody wants to ask any question further, lack of time, anything, you can directly contact me, as Dr. Katta shared my website. So make sure that if anybody, you can directly reach me also.
Sure.
And also we will share the any information that comes up, we can share it to Dr. Renuka also. And we would like to take privilege to honor your gracious presence today, Dr. Renuka, and for your precious time and sharing your knowledge and wisdom with our study group with the caste certificates. So kindly accept. Dr. Sweta.
Yes.
Thank you very much. Thank you.
And also we would like to share Dr. Lori Grossman, because we had this internet some disconnect and she has to leave. So thank you so much once again, Dr. Lori, for having with us today. And today we have many of our KHA volunteers, Dr. Pooja Naik, Dr. Mamata Kumar, Dr. Richa Panwar, Dr. Poonam Shablani, and many more KHA volunteers have joined us today. And Dr. Renuka, we would like to announce the upcoming events. Okay.
Yeah.
So on April 9th, 2023, we have Dr. Dinesh Chauhan, world-renowned homeopath, who speaks about integrative holistic approach in wisdom age. And Karen Allen about importance of Echinam. And this would be at 8:30 p.m. India time and 11 a.m. Eastern. So Dr. Dinesh Chauhan's case witnessing process, the right brain approach is, they have a course going on that will be in March. So for whoever is interested, they can visit his website, casewitnessing.com. And we have many more renowned homeopaths lined up for our KHA webinars. So stay tuned. And once again, I thank KHA Homeopathy Study Group team for the continuous selfless support and all the KHA participants for their undivided attention and inspiration. So Dr. Sweta and once again, Dr. Renuka, thank you. And with your permission, we will end this session. And Dr. Sweta, would you like to go ahead, please?
Yes, ma'am.
Thank you and good night to everyone.
Thank you so much, ma'am. We are very thankful to our honorable, respectable speakers for such an informative sessions at our KHA platform. And heartfelt thanks to all the viewers and followers of KHA Homeopathy Study Group for joining us today. For the future webinars info, you can follow our social media platforms like Facebook, Twitter, Instagram, and LinkedIn with the name KHA Homeopathy Study Group. If you missed any of the webinar, you can subscribe and follow and check out all the webinar recordings at our YouTube channel with the name Kavita Kukunur. Don't forget to fill the JOT form to receive your certificate. You will get it within 10 days after the webinar. For any other query, you can reach us at kstudygroup@gmail.com. Thank you so much.
Thank you, Dr. Sweta.
Thanks to all.